My monthly injection is normally $60 a month that I take for my migraines. So I went to go pick it up yesterday because I'm due for my shot today. Guess how much it was? Just guess. Nope. Higher. $780. $780, and it's normally $60. I can't buy it. I have tried GoodRx. I have tried Amazon Pharmacy. What else? What else did I try? I have looked up like copay cards. I have insurance through my husband's work. So that's the cost after insurance is $780. The pharmacist told me that whenever it was originally sent in, there was some sort of a coupon code attached to it. So that's why I was getting it for $60 a month. I never would have even started it had I known it was going to be almost $800 to refill every single month. This isn't even a life-saving medication. This is just so that I can live a semi-pain-free life. So for the people that need life-saving medication and can't afford it, what on earth are you supposed to do?
I just logged into my health insurance provider, and I'm in the same boat as so many people. It's absolutely stunning what just had happened. In June of 2025, my insurance went from $125 a month to now $426.84. And now, since it's open enrollment, it's unbelievable. I mean, I'm at a loss for words. It has now grown to $1,164.82. What am I going to do? How am I going to afford this? Do I have to cancel my insurance? Like, what's the way for Americans to get in health insurance? What are we all going to do? I'm broke. I can't afford it. It's a sad, sad day.
My husband and I are in the same boat as so many people right now, and I just logged in to our health insurance provider, and I can't even. In July of 2025, our health insurance premium went from $59 a month to $798 a month. And since it is now open enrollment, I just logged in to our health insurance to see what, if we stay on the same plan, what our premium is going to be for 2026. $1,208.91 a month. Our family deductible has gone from $0 to $11,900. Our primary care copays have doubled. Our urgent care copay went from $10 to $60. Our generic prescription copay has doubled. And this is coming off of the fact that my husband just had to have a prescription filled that is supposed to be covered by insurance. And you want to know what the copay was on that after insurance? $1,200 for a prescription, on top of the $798 health insurance premium that we just paid. And this doesn't have to do, this is separate from everyone else's rising costs in health insurance, but we are self-employed. We are real estate agents. And this is just in addition to the next time somebody wants to devalue or question how much their real estate agent is getting paid and wants them to take a reduction in their commission, just remember that your real estate agent is going through the same things as you, paying this out of pocket if they even have health insurance, withholding their own taxes if they can even afford to do so. And this is on top of the multitudes of thousands of dollars per month we have to pay in housing, or the thousands of dollars a month my mother was costing us before I cut her off recently. We can't, and it's not like the real estate market is just on fire right now. I don't know if we can keep our heads above water next year. And I know we're not the only ones going through this, and it just makes me sick.
So I have United Healthcare, and I have just received my benefit summary for next year. If I keep my current plan, my monthly premium is going up 52.8%. Let me show you. My premium will be going from an already outrageous $422.04 per month to $644.91. I don't understand how this is legal. I don't understand how this is ethical. I don't understand anything about it. If I didn't have access to the medications that I take on a monthly and daily basis, I would be so sick mentally and physically that I'm unable to work. How am I supposed to do this? Luckily, because the health insurance that my job provides has become so expensive, I qualify for a tax credit. And so my plan with my tax credit really isn't going up all that much, but still technically it is $650 for me to live every month, for me to survive. What is going on in this country?
A lot of Americans are not renewing their health insurance for next year, for 2026. Things are getting harder and harder here to stay healthy. And a lot of people aren't getting rid of health insurance because they don't care about their health. What is happening at this moment, healthcare premiums, they're getting even more expensive along with everything else. Cost of living, but your wage stays the same. That doesn't go anywhere. Or people cannot even find jobs to actually get health insurance. Sometimes people are paying over $1,000 a month for health insurance, and it just depends on how big your family is and what kind of jobs you have. And some people are just cutting corners, they're just trying to survive. Some people are just paying out of pocket, or they're heading over elsewhere to get the care that they need. This lady right here, she's been going to a dentist in a different country. She's been getting checkups in a different country. Some people are just opting for this rather than spending thousands of dollars every year on health insurance.
People are making the call to not have health insurance because health insurance is so costly and they're not receiving the benefit of having health insurance, and they rather save that money for their expenses for their household. I have been without insurance probably since 2010. I've been without insurance in the US probably since 2010. And it started with, I was paying, I believe, around $200 to $400 a month for health insurance for me as a single woman. And the deductible was still around $1,500. This was before I was an attorney, and I was working for a really prestigious law firm who had horrible insurance. And so as a single woman, I would still have to pay all this money just to see the doctor. And I remember making the call, listen, I'll take my chances. I'm young. I don't have pre-existing health conditions. I don't have a health condition that requires me to see a specialist every single month. So I decided to opt out of the health insurance and save that money instead. Just because I went without health insurance does not mean that I went without health care. I still paid out of pocket if I had to see my primary physician or if I had to see my GYN. I had no problem paying the $250 to see either one of those doctors. And so that was way more cost efficient than spending thousands of dollars a year and still having to pay another $1,000, $1,500 to meet the deductible. So I made that call. And now I see on TikTok, more and more people are making that call. I saw one person who mentioned that he canceled his insurance for a family of 3, and so far he saved $11,000 a year. And that's just one person. Other people are clamoring in saying they're saving thousands of dollars a year. and they're making the call to live without health insurance in the United States. Again, another aspect of health insurance is that I also opted to be a medical tourist. So when I traveled, I saw a doctor, because seeing a doctor in another country is infinitely easier than seeing a doctor in the United States and infinitely less expensive. So for instance, I went to Colombia last year, saw a dentist, saw a doctor, did full panel blood work. My blood work cost around $80. My dental work to clean, $44. So now every 6 months I travel to Colombia to have my dental work done for $44, so $88 in total. X-rays of my teeth, that was around $11. And so I even had some cosmetic teeth work done. I didn't have veneers, but I had what's called a gum lift. I think that cost $250 or $300. Infinitely less expensive than what the United States will offer. And so I invite you to think about being a medical tourist. You don't have to go without health care if you don't have health insurance, although the United States will like you to think that you're just going to molecularly combust if you don't have insurance, but there's always alternatives. Becoming a medical tourist, traveling to Mexico, traveling to Colombia, traveling to Cuba, traveling to countries that have a reputation of having comprehensive and robust and advanced healthcare is a solution for you and your family. So I started last year a medical tourism business, inviting Americans to travel to Colombia if they don't have health insurance, or even if they have health insurance, have had a difficult time getting the services and perhaps the medication that they need, even with their health insurance. So I wanted to introduce to America the alternative that you can get your health care in a different country and still get quality, advanced, and robust health care and not suffer in the United States. And so I invite you to think about it. I'll list the name of the company. So just to give you an idea, the cost to travel to Colombia, to stay for 2 to 3 weeks, to room and board for 2 to 3 weeks, food will still be less than what you're paying each month for health insurance, because I see some people paying around $800 a month for health insurance. So it's considerably less expensive in Colombia if you think about becoming a medical tourist. So let me know your thoughts. Have you considered canceling your health insurance in order to save on costs and to have more spending money in your pocket? It's definitely a reality. As of right now, there's some people think there's tax implications if you don't have insurance. The federal government does not impose a tax penalty if an individual does not have health insurance. There are a few states that impose a tax penalty if an individual does not have insurance. Those states are New Jersey, DC, Massachusetts. I forgot the other two. New Jersey, DC, Massachusetts. Anyway, I'll list them in the description box. But at least you know at a federal level, there's no penalty, and there's only 5 states. Many states have ruled it, well, in my opinion, it's unconscionable. There was some tax penalty, for instance, for New York, for several years for people who did not have insurance. That tax no longer exists. It was unconscionable at the time and unconstitutional for many reasons that I'm not going to get in here. But if that's a concern for you, just check to see if your state does penalize you. But in some cases, the penalty is still less than what you would be paying for insurance and what you'd be receiving, because you would still be paying the deductible, etc. So a $200 penalty may be reasonable for someone who decides not to have insurance, depending on what state one lives in. So let me know your thoughts in the comment section. Again, have you considered going without insurance in order to save, with the cost of everything being so astronomical? it's what people are deciding to cut. And it's completely valid and understandable. If I currently still don't have insurance in the United States. If I were to insure myself, I was quoted at $4,000 a month. So you do the math, 4,000 times 12, that's $48,000 that I would have to pay just to cover myself. Of course, I opted out of that. That's just ridiculous. That's unconscionable and it's unaffordable. Like, who can afford that? So if I need something done, I go to Colombia. And I've had a few visits to the emergency room where I get the bill and whatever, I pay it in payment plans. It is what it is. But I refuse to buy into that it should cost me $4,000 to insure myself as a solo practitioner.
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family, correct? Now, that does not include my vision, dental, 401k, or disability. So when you add all of those in, I'm paying about $550 every 2 weeks for my entire family to have medical, dental, vision. I have disability coverage, and I also contribute to my 401k. We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. That does not include my 401k, my vision, my dental, my disability insurance. How can I possibly survive paying $1,500 just in medical coverage? They already kicked our spouses off of our coverage because they said if your spouse can get insurance through their job, we're cutting them off. So not only did you cut them out, it tripled. $700 just for medical benefits every 2 weeks. I'm not even talking about a month. This is bi-weekly. How is this? And I work in medical. How is this fair? How does this work for anybody? I can literally cry. I have a daughter that's graduating college next year. I have a daughter that's getting married next year. On top of that, we have to live. How? How can anybody live spending just $1,500 a month just in healthcare that doesn't cover our dental, that doesn't cover our vision? On top of that, there's a $2,000 deductible and a 20% co-insurance. So either way, anytime we go to the doctor, anytime we do anything, we got to come out of pocket. On top of what I'm already paying.
So I just opened a health insurance letter telling me what my premium is going to go up to in 2026. Currently, I pay like $27 a month, Affordable Care Act or tax credit or whatever. Health insurance premium for me is going up to $511 per month. In 2026, I will be responsible for $511 a month for health insurance. I'm just going to be transparent about what my income is. So per the IRS, I have to pay myself a reasonable salary for the role that I do at my company. I pay myself $40,000 annually. It works out to be 40-hour work week, like $19 and some change per hour. Which, by the way, I actually do not think $40,000 is a reasonable salary for the work that I do, which makes me getting paid lower at an hourly rate than my staff. However, I don't work 40 hours a week. I probably work 80 hours a week, so I don't know, it's even less than that. All this to say, if I wanted to get on Medicare, the most I can make per year is just under $17,000 a year. I make too much money to be on Medi-Cal, but I don't make enough to pay for health insurance. If something were to happen to me catastrophic, like, I don't know what I would do. I'm 45 years old. You know, like, I need to be having certain cancer screenings, and if I could pay myself less, I would. More back into the business. Also, like, $40,000 is like barely enough to live on in California. Most of my salary goes towards paying for gas in my car. It's gas and groceries is what I spent all my money on.
And it's only getting worse. I have been rejected for things that are necessary, recommended by my doctor. My insurance has been like, well, I don't think you need that. And it's like, well, you're not a doctor. The best thing to do right now is make sure that you take care of your health however you can. Get some exercise, try to eat healthy. You just never know if your health might cost you a lot more than you bargained for. Anyway, leave your comments down below and let me know what you think about this topic, and I will see you in the next video. Thanks for watching. Bye.